Hi, my name is Todd Austin from Austin Family Chiropractic in Verdon, Illinois. I'm a chiropractic physician who specializes in helping my patients to obtain deep, quality, restorative sleep on a nightly basis. In fact, it's not uncommon for my new patients to report that within 2 nights, they're already sleeping much better than they have in years. It all started this past winter when I signed up for an advanced clinical nutrition certification course. Now, I'll admit that having been a chiropractor since 1993, I've read many a book on diet and nutrition. In fact, I'd put my old skill set of nutritional knowledge up against most medical doctors any day of the week, and I'd come out squarely on top. But I signed up for this clinical nutrition course because I wanted to help more people and help people more than I already was. I went on to learn a great deal about vitamins and minerals, but I was most amazed by the plethora of bonus knowledge I learned regarding something known as specific amino acid therapy, which just so happens to lead right into my new niche as a deep restorative sleep specialist. I'd like to refer you to something called the Brain Function Questionnaire. It was developed by Dr. Roger Murphy, my instructor at the recent Advanced Clinical Nutrition Seminars. The Brain Function Questionnaire is used to help me, the clinician, to determine the patient's specific neurotransmitter or hormone deficits. Depending on which neurotransmitter or neurotransmitters are lacking, I then have a very good idea of which specific amino acid or amino acids to place the patient on, along with a high-quality multivitamin, multimineral supplement to correct the problems. A much more detailed description of specific amino acid therapy is available at my website. The exact URL is noted below. What more can I say other than I totally resonate with this specific amino acid therapy work? It gets me excited and it keeps me excited. Yes, in the 6 months I've been helping patients with specific amino acid therapy, I've seen some amazing things that have totally blown my mind. I'd like to share Tammy's story with you. Tammy was injured at work. She suffered from constant headaches, neck pain, and weakness of her left arm and hand. She was laid off from her job. She wasted 3.5 months following the advice of a general practitioner and an orthopedist. Collectively, they had her on a total of 7 different medications, including Ambien to help her sleep, 2 meds for headaches, 2 drugs for anxiety, 1 for depression, and 1 for generalized pain and inflammation. Then, this not very dynamic medical duo of the GP and the orthopedist gave up, threw in the towel, and proceeded to tell Tammy that she needed to see a shrink. Instead, Tammy came to me, desperate, in tears, and claiming to feel, quote, like a drugged-up zombie with no life who never wants to leave the house, end of quote. Totally uninterested in the psychiatric approach, with the possibility of even more drugs. She then heard about my work and was instead seeking a combination of chiropractic and specific amino acid therapy as her last resort. Within 48 hours of her first visit to my office, she was sleeping better than she had in 5 years without the Ambien. Within 2 weeks, all signs of her anxiety were gone, all headaches had disappeared, and her arm was normal once again. After 3 weeks, when I released Tammy, when she had reached maximum medical improvement, all symptoms of depression had resolved, her neck was 100%, and her energy levels had returned to normal. And even more amazing, she was already off of all 7 medications. Yes! Lastly, I'd like to share with you a testimonial by Stephanie. Stephanie states, quote, after I gave birth to my daughter, I spoke with Dr. Austin about my increased anxiety and my fatigue. He suggested that my hormone levels could be deficient, and he recommended vitamins and amino acids to correct the problem. He couldn't have been more right. Within 1 month, I was feeling better than I had in a long time. Once again, that was from Stephanie. So as you can see, I might just need to help a patient balance her natural, God-given neurotransmitter levels. Or I might need to help her gradually wean off, get off, or stay off of antidepressants and or addictive anti-anxiety drugs. Or I might need to help her drastically improve the quality of her nightly slumber so that her aches and pains can resolve much quicker. Whatever the case may be, specific amino acid therapy has a lot to offer mankind. In 2010, I feel truly blessed to get to help more people and help people more with a combination of both chiropractic and specific amino acid therapy. Thank you and have a great day.